it's important to understand that most of these things are trending or have a trend over time.
Either way, if you have symptoms, you want to come in early, because if we catch it early, we can cure it, treat it early.
Most of the time, most cancers are just from years of the cells mutating and getting damaged and having turnover and then eventually becoming something.
Because it's common enough out there in the community or in the world that we would want to be able to catch it.
All right, everybody, welcome back to another episode of
What the Health?
What the Health with the Naiman Brothers.
I'm Dr. Greg Naiman.
And I'm Dr. Ted Naiman.
All right, welcome back, guys. So we're going to go over a topic right now in terms of how to prevent stuff, right? Again, which goes back to this whole concept of screening. So screening means basically you want to catch something before it happens. So how do we screen? You know, it's kind of like sunscreen, right? So, you know, you put on you lather up with your sunscreen so you don't get cancer, skin cancer. What other screenings are important? So let's break it down by age ranges. So what do you want to start with, bro?
Well, I mean, I always tell everybody, so like when I bring this topic up for patients, I always tell them we screen for things that are either A, common, or for things that are, if we catch them early, we can fix them.
So that's a good point. So before we get into the different things that you should do by the different decades, maybe we'll start with explaining why we do screenings in the first place, and when is it appropriate to do something versus not appropriate as a screening test.
Yeah, because like if there is something that happens like in 1 out of every like 10 billion people, which aren't even 10 billion people on the planet. But again, so that would be pretty uncommon, right? But if something that's very rare and very uncommon, if we screen for something, like why would we if it's not even something that's that common? We'd be spending a lot of money to try to identify something that is like, again, very uncommon and not likely going to happen in the population.
Sure.
Number two, sometimes in that case, if we're screening for things and if it's not necessarily that common, you're always left to think, am I dealing with a false positive? Then you're looking at like things like more of an statistical analysis and design is like, hey, is this thing a false positive or is it a true positive?
Sure. So let's break down that nerd talk. So basically it comes down to if we have two main areas, right? You got what we call screening. I don't have a symptom. I don't have anything that's showing up, but we're going to check because it's common enough out there in the community or in the world that we would want to be able to catch it. So as opposed to now I have a symptom and I'm coming in. That's not a screen, that's a diagnostic test. So if I come in and I'm having really bad, abdominal pain, my bowel habits changed, I'm having blood in my stool, hey, I need to get a screening colonoscopy. Well, no, you need a diagnostic test. You don't need a screening test.
Either A, you went to Taco Bell and had some food and now you're having some digestive stuff, or you might have some other stuff going on, of which then we're going to check some tests on you. And depending on the things that we would check at that time, again, if you're having symptoms and it comes back, then there's a higher probability of like that, we identified something and then we say like, it's very likely that you have this condition.
So that's a diagnostic test if you're having symptoms. You don't have symptoms, but it's common enough out there in the population for, again, your age, your race, your sex, then we would want to then do these screening testing. So you come in and now I'm somebody who's let's start with the 20s.
Sure.
So, all right. So we broke it down. We understand that screening, the difference between screening and diagnostics and why we do screening things is because A, it's common enough, and B, we actually have something that we can do for it. So what are some of the things in our 20s that we would say, you got no symptoms, you should still come in because there are certain things that you want to get your screenings on or preventative testing done?
Yeah. So a couple of things that start happening when we're in early adolescence, middle and late adolescence. You're not generally old enough to have had a whole lot of stuff going on in your body. That's where we're going to start looking. Meaning when we start talking about like increased risk of developing certain types of cancers, most of the time, most cancers are just from years of the cells mutating and getting damaged and having turnover and then eventually becoming something. Only a small proportion of people who have some genetic thing. So then we say, okay, so the people who are in their middle, early, middle, or late adolescence, we start screening for psychological things.
Sure. Mental health is a big one. Yep. Anxiety, depression. So that's going to be a big thing that we're going to want. Again, even potentially even things like attention issues and concentration stuff. Sure.
We start screening for things that are generally acute in the infectious side of things. So when we say acute infectious side of things, depending on the individuals and what they've been doing in their lives in the early, middle, and late adolescence.
There we say some sexually type of transmitted infections.
Right. So again, it would be things like screening for HIV, potentially screening for things like syphilis, potentially screening for hepatitis, potentially screening for things that are like a secondary impact of like getting human papillomavirus.
Sure.
So those are things that are generally acquired through some kind of interaction that would potentially not necessarily feel it. Like most of the time when people get those kind of conditions, the way our body's immune system works is that, you might get a bad cold or flu-like symptom, and 3 weeks later you're feeling back to normal, but come to find out a year later through one of our screening tests that you had contracted HIV or hepatitis, and your body got hit with the virus. It felt like crap for a couple of weeks, but then your body did
like every other virus. Sure.
Right.
So those are going to be important screenings. So we're going to be screening for sexually transmitted infections, and all of them either bloodborne or urological. So fancy way of saying it's going to be in the genitalia. So especially for women, because a lot of times they don't even know they have it, but even guys too. So now we're checking, testing for the urine. We're checking blood borne, and then so that's just on the transmitted infections.
Right. And so most young people don't even realize that, for instance, like chlamydia, where most men, it's not like they're purposely going around and trying to infect women, but most men don't even feel any symptoms of chlamydia. So they go around and they have intercourse unprotected, and next thing you know, they're transmitting chlamydia to all their partners.
Right. So later in life, and we'll talk about that later, we check on the big C, this age range, we check on the little c, chlamydia. So we're checking sexually transmitted infections. We're doing, again, in terms of mental health screenings for depression, anxiety, make sure that that's normal. And then what we'll go into next is probably, we'll just keep rolling with it. So let's go to
along
the
lines
30s
of
and
this,
40s.
so like then there's also other things. So there's potentially acute infectious or contagious things that individuals can get. There's psychological things, but there's also things that potential other things and harmful things that people could be doing. So screening for substance abuse and substance use or misuse as well.
Sure.
So those are all the kind of things we start in early, like early life,
Sure.
Meaning, late teens, mid 20s, even low 30s. I guess even into mid 30s or so. But so when we start getting into like the upper 30s and into our 40s is when we start maybe looking that now your body's had enough time where you might have had enough exposure and enough damage and turnover in those cells that maybe if you're female or male, you might start being at higher risk of things like breast cancer, prostate cancer.
So let's go into the 30s and 40s. So the next segment that we'll go over is going to be your 30s. So what you're saying is that things that we tested for in the 20s don't change, but now we stack on. So, we were checking those kinds of things from a prevention or screening perspective in your 20s, your substance use, your, again, anxiety, depressions, other mental health things, and then, of course, your infectious type things. Now we're talking into our 30s and 40s and things that happen over here that you should have been screening. Even now we see, even in adolescence and even earlier, it's been recommended to screen for things like blood tests for certain screening, but it becomes even more important in your 30s and 40s. And those are going to be like your cholesterol screenings,
metabolic stuff,
and then your blood pressure screenings. And we even recommend now your blood sugar screenings, and you're coming in more often for those types of things on top of the other screenings that we just talked about. So in your 30s and 40s, the shift now is going to be on more of those things that are going to hit on more of a cardiovascular and metabolic health perspective.
Right.
So beyond, you got to come in. Women, you're getting your pap smears, and guys and women, you're getting your urinary testing as well as blood testing for that. While you're getting those blood tests, you're going to get the new ones. Let's go into a little bit some of those tests and why they're important. We just
so I mean, like you're talking about the metabolic things, or just like,
metabolic. So like, again, the cholesterols and the sugars and blood pressure readings.
Yeah. And mind you, I feel like going back to like a lot of the current recommendations that we see out there, and I know that you and I both agree on this, is that it's been biased by insurance plans to kind of like, shouldn't be checking these things because they kind of hide behind like, it's not that common, or it's not that relative. But I think that's relative. Like, meaning when I say relative, it's important to understand that most of these things are trending or have a trend over time.
Sure.
And like, why wait until you're in your 30s and 40s to start checking like things like lipid panels or like blood sugar numbers and values,
Right.
or like things like, you know, HSCRP, like a highly sensitive CRP, you know, or lipoprotein little a. These are things that like detecting those and looking for those things even at a younger age
Right.
potentially could have an impact, because it's like what you're doing at that age is are the things that are going to have like an impact, you know, when you're into your, you know, 40s and 50s. So these are the times in my mind, and I know that you and I both agree on that. That's like, you know, that's when you want to really start understanding that, seeing that, and then putting that in front of the individual and saying, hey, look, you're in your 20s and 30s. Your blood sugars are already climbing. We're already at the higher end. Sure, they don't like pass the line already of what people would call diabetes, but they're trending that way. So let's know now as opposed to knowing later. And they're pennies for those tests.
So it's a good point. So even though we are